So it is my pleasure to welcome Dr. Vanessa Valdez. Dr. Valdez is a board-certified specialist in orthopedic physical therapy. She obtained her BSc PT from the University of Alberta in 1980, a master's degree in acupuncture from the Tri-State College of Acupuncture in 1999, and a DPT from Arcadia University in 2015. She has worked in a variety of clinical settings in Canada and the U.S. She currently practices as a clinical specialist in outpatient orthopedics at Mount Sinai Medical Center in New York City, and was a faculty member at the Tri-State College of Acupuncture from 1999 to 2019. As a duly licensed physiotherapist and acupuncturist, she has written about scope of practice issues and adverse events related to needling treatments. Again, welcome, Vanessa, and now over to you.
Thank you so much, Nancy, for inviting me to speak with all of you today. As Nancy mentioned, I actually am from the U of A, and we graduated in the same class in 1980. And this is such a delight to be talking to you today because, as Nancy said, I work in New York State, and it is one of only 6 states where the law still prohibits physical therapists from performing any type of dry needling. So it's really a delight for me to be able to talk to you on this topic. We have a lot of material to cover. As Nancy said, we'll have some time at the end for Q&A, but I'm going to dive right in. Both acupuncture and dry needling are generally considered to be pretty low-risk interventions, but serious complications, although pretty rare, have been found in the literature. But as an invasive intervention, any practitioners must be cognizant of the risks involved with this modality. And I know in Alberta that we do find that both acupuncture and dry needling are part of our practices. And I hope you have something for everybody in this talk. Here's an outline of the course. I'm going to start by talking about the frequency and types of adverse events that can occur with these needling treatments. And then we're going to look at the mild adverse events like bleeding, bruising, pain, both during and after a session, and the vasovagal response. And then we're also going to look at some of the more serious or severe adverse events that have been reported in the literature, including pneumo and hemothoraxes, infections, the problem of a serious bleed, a cardiac tamponade, problem of hitting the nerve, and then I'm going to finish talking about the special concerns about treating pregnant women or if you lose or break a needle. And some of these will include some pretty gory case studies to help to keep you listening. First of all, I want to say that there are some differences between acupuncture and dry needling. Most of the research out there does look at acupuncture, which has been around a lot longer than dry needling for trigger points. Dry needling will often involve a deeper needle insertion and a manipulation of the needle to create what we call a local twitch response. And obviously, we don't usually retain the needles. We get the response we want and remove the needle and discard it. Where acupuncture, we're going to needle to reach the depth of the acupuncture point and manipulate the needle to get the sensation known as dachi. And again, needle retention is common. It might be 15 to 20 minutes or even longer, depending on the response that we're looking for. And of course, there are many different tools of acupuncture and varying needle techniques. The one thing that both dry needling and acupuncture do have in common, of course, is the use of normal solid filament needles that are certainly disposable, and that is the one thing they do have in common. So why are we talking about this topic? Well, a culture of safety is really imperative in medicine. I read that medical errors were the third leading cause of death in the U.S. This is, of course, before the pandemic, but it is a substantial thing that we have to be concerned about. Adrian White once said that any treatment that can have effect can also have an adverse. And what is an adverse effect? Well, I like this. This is a definition from the Physiotherapy College Practice Guidelines. Basically, what is this? It's any ill event, no matter how small, that is unintended and not therapeutic. I think there might be a little bit with the patchy connection. If you cannot, if I'm cutting out, please let me know. I'm not sure what else I can do from my end, but I do apologize for that.
Yeah, Vanessa, sorry. Yeah, it's just Pat. It's just clicking in and out a little bit. I'm not sure if you're. Yeah, I'm not sure. So we'll do the best we can.
Okay. Okay.
Okay.
Yeah.
Thanks.
Okay. I'll bail on ahead. Okay. The adverse events. Let's go back to where we were. Okay. So how common are adverse events? Unfortunately, there are no national or international tracking systems that we can plug into to look at the data. The usual method is to send out prospective studies. And basically what these are, they're surveys that are going to be sent to either a practitioner or a patient, and they're basically designed for this purpose. The self-reporting of practitioners regarding adverse events, of course, is going to be limited both with accuracy and reliability. It's kind of hard to remember what happened, months after a treatment for a lot of us, especially if we have a very busy practice. The other problem that can happen is an adverse event might become obvious after a treatment session, and a practitioner might not even be aware that something had happened. When we look at the stats, they may actually be underreported. We can also look at the case studies that have been published. Case studies are helpful in telling us a little bit about the types and treatments of an adverse event, and how to prevent them from occurring. But clinicians often are going to be reluctant to admit that they actually made a clinical error and they screwed up. Often the person that's going to write a case study is the person that ends up treating the patient. So, for example, somebody who's treating someone who had a pneumothorax after somebody needled the upper trapezius and went too deep. Okay, so again, those are the things that we generally look at are studies and the case studies and the surveys. So when we look at the literature, we can certainly divide adverse events as far as severity, mild, significant, or serious. Things that are mild are generally of a short duration, totally reversible, and they will cause minimal inconvenience to a patient. Something that is considered to be significant would actually require some type of medical intervention and could interfere with a patient's activities. Something that's serious could actually cause a hospitalization to be required or prolong a hospitalization. Could also cause a persistent or significant disability, or could be life-threatening. So that's something really important when we're looking at the severity. It varies widely. Again, things that are mild would often occur for a couple of hours, where something that's significant or serious could end up lasting for days, months, even years. You can also look at something that's avoidable versus unavoidable. Sometimes you are going to have a bruise. That's an unavoidable adverse event, but certainly losing a needle is something that is avoidable. And you can also look whether or not the adverse event was the result of the standard practice that we have or something that the practitioner did that was neglectful. This is a slide which basically summarizes the data from 4 very large studies that have been published. I looked at all the studies and sort of combined them in this table. This is actually in the paper that Nancy said that the publishers have allowed us to share with you today. So I'm not going to spend too much time in that, but certainly the paper will go into that in greater detail. I do want to quickly talk about some specific studies, however, that look just at physiotherapists in their data. The first one, two of them were published in 2014. McDowell is a paper that came out of New Zealand. And what New Zealand has is an interesting program. They implemented a voluntary system so that physios could actually report adverse events in their practice. And this does include the needling modalities. And what McDowell did was they actually did a cross-sectional descriptive study of the 176 self-reported adverse events that did occur as a result of either acupuncture or dry needling in these New Zealand physios. And of these, 81% were considered to be a minor adverse event. Certainly that was very nice to read, that there were no serious side effects in any of these cases. On that same year, Brady out of Ireland published what was the first work that looked just specifically at dry needling of trigger points. Now, this was a prospective survey of Irish physios, and what they did, these physios had all had some 64 hours of training in dry needling, and then they were asked to participate by surveying the number of treatments that they performed in a period of time, and if there were any adverse events. Now, it was interesting that about just over 19% did report some mild adverse events, and these were things like bruising, pain, and bleeding, but there were no significant adverse events reported. You'll often see the Brady study touted as how this is such a safe treatment for us to be performing, but a major limitation of this paper is that the data, of course, was self-reported and practitioners voluntarily participate, which may result in an underreporting or inaccurate survey. And the study is also being criticized for not reaching a target level of intervention that would have been required to actually identify those more rare serious adverse events. Only 39 physios had actually completed the survey. So last year, Boyce took that original survey and tweaked it a little bit, the one from the Brady study, and sent it out to a lot of American physical therapists who dry needling. And of this, there were 420 participants, and they again looked at the number of dry needling treatments and adverse events that did occur. And there were quite a few adverse events. About 37% of people did report some, but these were pretty typical and the expected responses to using a needle, like bruising and bleeding. Major adverse events were less than 0.1%. The most common of these was a symptom aggravation or forgetting a needle. Okay, so that's enough talking about the frequency. Let's dive in and look at what actually can go wrong. First one is bleeding and bruising. Now, again, we've all had a needle. Maybe you're getting your vaccine right now, or soon, let's hope. But mild bruising or bleeding is very common with any type of needling activity. The type happens with acupuncture needles or these fine filament needles is less than the big hypodermic needles, just because the gauge, of course, is much smaller. But we can often see a dot of blood that can occur either outward or inward, and a small hematoma can certainly happen. Generally, just using mild pressure over the needle site can be enough to stop bleeding. The problems, of course, are if we actually pierce an artery. Arterial bleeding is rare. It's quite hard to get through our arterial wall, but it will spread quickly and pulsate. If the bleeding occurs into a fascial compartment, of course, that increased pressure could cause tissue damage. So theoretically, those could occur. How do we manage bleeding and bruising? Again, sometimes it will happen. When we screen patients for these treatments, it's important to understand if they have bleeding disorders or are using anticoagulants. patients with severe thrombocytopenia are not suitable candidates for dry needling intervention. But we can treat people that are on anticoagulants. McCullough in 2015 did a systematic review to evaluate the safety of acupuncture patients on anticoagulant meds. And it was found, they basically asked the question of looking at these articles. They said, does acupuncture in an anticoagulated patient present a higher than expected risk of bleeding? And they found the bleeding complication rate was only 1.4%, which is very low. The majority of these was either just like a little asymptomatic bruise or a minor drop of blood like you'd see with any needling procedure. No bleeding in any of these studies was considered to be significant. So they basically concluded acupuncture has a high degree of safety with patients undergoing anticoagulated medication, but you shouldn't understand that they are on these medications. In acupuncture, a lot of my fellow practitioners and myself have used anti-bruising topical products if a bruise does occur. The one that's used most commonly is called Arnica montana. If you're not familiar with this homeopathic, you often use a gel or a cream in the clinic. It's a perennial herb that is thought to have an anti-ecchymosis effect, probably from a vasodilatation effect or a possible upregulation of microphagy activity. But, of course, if we look at the literature, we do find this study did look at all the randomized control studies, and it found that homeopathic arnica was no better than placebo in treating either bruising, swelling, pain. So sometimes you just do that to make people feel better, but really there's not a lot of data to back up. It's going to make a difference. As I mentioned before, we can have serious adverse events, and I'll just share a case study that was published in 2018. This Berrigan case reported the induction of an epidural hematoma as a result of dry needling. This patient was an otherwise healthy 62-year-old woman. She had a body mass index of 19.1. So, very slender woman. She was being treated for myofascial neck pain, and she'd had some dry needling of the infraspinatus, the upper cervical multifidi, rhomboids, and tracts. And she'd had a couple of treatments, but on the fourth treatment session, after a needle insertion, she reported to the therapist she felt this warm sensation throughout her body. And later that day, she started to feel increasing neck stiffness and pain. 3 days later, her grown daughter, went to go visit her mom and found that her mom's mental status was very, very worrying. She called an ambulance and they brought her to the ER, and that's where they found this complex epidural hematoma. She was admitted into the neuro-intensive care unit, and the good news was she did have a gradual resolving of this neuropathic pain but it took about 2 months after her hospital discharge. The reason I'm mentioning this is one of these studies that really makes you need to understand the relationship between needle depth and body mass index. You know, how important it is to understand the specific anatomy and the needle trajectory. So that's a pretty scary case to think about. Pain is a very common adverse event, both during and after treatment. We tend to see this much more commonly with dry needling compared to acupuncture. The Brady study, that was the Irish physios, it found that between 2 and 3% of people will have pain either during or after treatment. So this is a substantial number, and it's something that you should tell patients. You may feel a little sore after this session is over. The other thing that we're not really sure why people have pain. It might be some type of neuromuscular injury or some bleeding or inflammatory changes that do occur. When we look at this post-needling soreness, there's a lot of research that has some interesting things I just want to bring up for you today. First of all, there is no relationship between the development of a local twitch response and post-needling soreness. So that's something that's important to know as you're working on dry needling treatments. But we do see that the number of needles that you use and the pain that the person experiences during the treatment is going to have a positive correlation to the pain they have after the treatment. The one thing, so I'm just going to move this slide back. This pain is going to be felt as a constant pressure or a dull aching. It's sort of like the kind of discomfort that you feel when you've overdone it at the gym. The great news about post-needling soreness, it usually lasts no more than 3 days. So again, it's something I tell people, you might be a little sore after the session, but it will be quickly resolving. In the old days, Simon, who wrote the textbook on trigger points with Janet Travell, they used to recommend avoiding any type of strenuous activity for a couple of days after post-injections. And again, this is when they used to use steroids or saline, but there is really no studies to support this, and we really don't have to have people really take it easy. But I want you to be aware, especially with your athletic population, if somebody is going to be having some major athletic competitions going, you might not want to do a lot of dry needling right prior, just in case they feel increased discomfort. Additional therapies, like our traditional modalities, have often been suggested as something that can be helpful in reducing post-needling soreness, but there's not a lot of research that backs that up. Okay. The other adverse events, which is considered to be mild, but it's very frightening both for patients and ourselves, is the vasovagal response. Now, we've all learned this in PT school. Basically, this is a neurally mediated syncope. And again, those signs and symptoms are related to the fact that the autonomic nervous system response has created an efferent response that causes bradycardia, hypotension, and syncope. And the signs and symptoms are variable, but it can include people feeling dizzy, nauseous. They might start to sweat and look pale. They could also feel lightheaded or feel warm. They might have a blurring or tunneling of the vision. And they may start to look unresponsive. Well, how common is this? Well, it's interesting. This study in 2017 by Christensen actually was a chart review. They looked at an 18-month period of people that had been attending an acupuncture sort of community clinic for about an 18-month period. They looked at 281 treatments, and we found of that they had actually 5 cases of documented vasovagal response that required a treatment to be either terminated or altered. Of these, 3 of them were first-timers. The other thing they all had in common is everyone had reported increased stress levels prior to the treatment. So how do we avoid this from happening? You want to be aware of those people that have had a history of fainting, especially associated with pain or the sight of blood. And we also want to be aware that a lot of people are needle phobic. You're going to have increased problems if a person is really nervous, if they're poorly rested, if they have a weak constitution, so people have just been hospitalized or just getting over an illness, or if they're hungry or dehydrated. And again, we have to watch people that have never had these treatments. So how do we prevent it from happening? If you're a fan of acronyms, think about PEACHES. First thing we're going to do is we are going to position the person either in a supine, a prone, or a zero-gravity chair. You never want to go, oh, let me quickly release that upper trap. Sit down there, because if a person has a vasovagal response, it's going to be really hard to get them on the floor safely. Experience plays a role, certainly of the patient and yourself. And, you know, we can all feel a little anxious, especially when we're learning these techniques, and our stress reduction ways of reducing stress can be very helpful. Hydration and feeding, again, it's very important. I always tell people they have to eat and drink at least 2 hours prior to a session. And we know that more and more people do fast either for religious reasons or for dietary reasons. If somebody, for example, if during the month of Ramadan, if somebody definitely needs these types of treatments, you're going to get them in first thing in the morning. Most of us, as far as environment, our clinics, we can't usually control how busy they are, but try and do these treatments in an area that is quiet and calm. And certainly recognize when a person might be having a vasovagal response. That's the most important thing, is you want to recognize it's happening and initiate airway, breathing, and circulation. The most important thing is you want to remove the needles and elevate the feet. And certainly communicate with the person on what you're doing. Sometimes acupressure can be helpful, especially if the person has completely fainted, and we'll talk about those in the next slide. And then again, you're going to reassess the patient, continually monitor blood pressure and pulse, and other signs of autonomic nervous system dysfunction. Again, you're not going to let these people go back, leave the clinic until they are fully back to their old normal setting. It's important for you to document that this has happened and really encourage a person to let other providers know that this has happened. Now, if you're an acupuncturist, there are a lot of points that we can use to revive people. My favorite is the point called Do 26, which is right underneath the nose. And again, this point, you're in the right slide, Vanessa. Okay. Yeah, there we go. That point is in the upper philtrum, and by stimulating it either with your nail or a guide tube, it can really help to pull people back. You can also use stomach 36, large intestine 4, any of the pericardium points in the hand, or any Jingwell point at all can help stimulate a person and bring them. Okay, so once again, I hope that you're seeing what I'm saying. There we go. Okay. Now, let's move on to serious adverse events. These are the ones that hopefully we will never encounter as practitioners, but it's important that we know that they can occur. The most important one that we often see is the development of a pneumo or hemothorax. And again, these are either air, gas, or blood in the pleural cavity. It is the most serious complication of either acupuncture or dry needling, and it's the reason why we're of concern is we often needle the area of the thorax. The one thing that you want to understand is most people will fully recover, and mortality is rare, but you never want this to happen. There are a couple of types of pneumothoraxes. We can have a spontaneous pneumothorax. What these are, they occur primarily with smokers. I just want to make sure, I think the slides are going a bit wonky. Hopefully you're seeing types of pneumothorax here. These spontaneous pneumothoraxes that can just occur happen with males, often people that are quite slender and slim. Other risk factors include Marfan's syndrome or a family history. A secondary spontaneous pneumothorax are those that occur with people who have serious lung conditions, such as, I don't know why I'm not able, I think.
Here's what I found.
Anyways, okay, I'm glad. Thank you, Nancy. I see that we're on the right slide. The type that we're concerned about in acupuncture and dry needling is the Iantrogenic Pneumothorax. And this occurs when the needle is advanced too deep into the tissue and punctures the pleura or the lungs. As a result, we have to recognize when this has occurred. The problem being is the acupuncture-induced iatrogenic pneumothorax can sometimes take many hours to develop and may not be evident initially when the person is in your clinic. In young and healthy persons, the decrease in vital capacity that occurs might take a while to show and show minimal signs and symptoms. Basically, the signs and symptoms are not unlike COVID. You might feel shortness of breath, you might have an increased respiratory rate, dry cough, cyanosis, chest pain, and certainly as we all realize, the way we diagnose this is with ultrasound or x-ray. So medical consults are important if we feel that this might have occurred. What we end up doing to people that have a pneumothorax is dependent on the degree of collapse and the health of the person. If it is a minor collapse of 20%, the monitoring of the patient is usually sufficient, as the lungs will eventually reinflate. Something that is more moderate or severe, that's 40 plus, 20 to 40 in the case of moderate, or severe, which is more than 40% of collapse, you might need to have oxygen supplementation, especially if their oxygen sat levels are low. And you might actually require a chest drain to occur. Okay. I'm going to talk a little bit right now. Let me see if we're on. Oh, okay. A couple of case studies. There's many out there on in the literature. This first study came out of Australia, and this was one emergency room. They found that 3 cases of traumatic pneumothorax came in after acupuncture or dry needling. The one thing that all of these patients had was low body mass indexes. So again, this is really important for you to realize when we're treating patients. The next study I want to just tell you a little bit about was a case of a bilateral pneumothorax. How frightening is that? Very frightening. And you think, well, that must be very, very uncommon. But there was actually a case of a physical therapist in Ontario in the last couple of years who did create a bilateral pneumothorax as a result of her treatment. When I took some trigger point dry needling training with the Myopan company, they actually recommend that when we're treating people that for myofascial pain, that you only work on one side of the chest in one treatment session, just to prevent this from ever happening again. This is a case I wanted to just bring to your attention. There was a pneumothorax that was sustained in an acupuncture training program. This was a program for Portuguese physicians. They were learning to needle points, and what they would do is after the needle was inserted into a muscle, they would stimulate the point with a handheld electroacupuncture device to confirm that they did get into the muscle. What happened, they were learning how to needle the anterior scalenes, and they zapped the muscle, and the person had this sudden involuntary movement of their arm because they had actually stimulated the brachial plexus. Ouch. And what happened to this physician? He started to feel mild chest pain and crepitation, but of course didn't do anything about it. But the next day in class, his symptoms actually worsened, and he started to develop a dry cough, and they subsequently got him to the ER and certainly had developed a pneumothorax, which did require oxygen therapy. So again, the reason I'm bringing this one up, it's really important when we're treating any patient that with needles that they can't move around. If something needs to be scratched, you're going to do it for them. So again, no quick movements. Okay, so how do we prevent a pneumothorax from happening? What the most important thing is, again, is the good knowledge of our anatomy. Anytime we're needling in the supraclavicular, peristernal, or thoracic area, ribcage area, we're going to have a risk that we could end up inserting into the lungs. Again, another important thing is you want to avoid needling any type of just because there's a bone there doesn't mean that there's not a congenital foramen. And those can occur in infraspinatus and supraspinatus regions. We're going to talk a little bit about what happens in the sternum in a minute or two. Okay, so that was basically pneumo and hemothoraxes. Now, infections are a much rarer side effect. Fortunately, that we have seen a decline in the last number of decades. And the main reason for this is an improvement in education standards and the use of a single-use disposable needle. This slide shows the clean needle technique manual. In the U.S., the clean needle technique course is mandatory for all acupuncture licensing. And these guidelines were developed to help reduce the risk of spreading infections. This information is often updated and with OSHA and CDC information. I highly recommend that you get a copy if you're interested in it. Mostly, we've all received education and prevention of infection with our, and most important is to maintain the WHO guidelines. I'm going to go through these pretty quickly because I know that we've all seen what an infection looks like. And again, redness, swelling, pain, local heat. Most of the infections associated with dry needling or acupuncture relate to mycobacteria or MRSA. Again, though, even though it's a relatively rare thing, there have been some recent case studies I've just put up for you to have a look at. This first case study was a 16-year-old who developed a major abscess in his thigh after dry needling for an iliotibial band. This poor young fella actually had to have antibiotics for 3 weeks after he was discharged from the hospital. Clean needle technique was documented, and the authors were uncertain if were not certain if this was a coincidental development or some type of clinician error. There's also been a case, this was a case by Callan from 2016. This patient was a 15-year-old who'd had some spinal arthrodesis for scoliosis treatment, and she'd been having, about 2 years later, had some dry needling for chronic periscapular pain and developed a major abscess that necessitated operative debridement and 2 months of antibiotics. The author concluded that the deep needling infection from the acupuncture or dry needling may have contaminated the spinal instrumentation. There was also a case from Holland of a 57-year-old man who had had a total hip replacement and had then developed a bacterial infection about 7 months afterwards after having some dry needling. Unfortunately, they tried antibiotics, it was unsuccessful, and he needed surgical debridement and irrigation of the area. Now, the authors concluded there was no strong evidence for a causal relationship between the dry needling and the infection, but do recommend that we use caution in patients with joint replacement because of an increased risk. Okay. Keeping my eye on the time. Let's talk about the cardiac tamponade. This was one of the scariest things when I was an acupuncture student. We heard of a case of somebody needling one of the acupuncture points in the front of the chest and actually piercing through the sternum. So what is a cardiac, and killed the person. What is a cardiac tamponade? It's a compression of the heart that happens if blood or fluids build up around the pericardium. The main reason this could occur is if we are needling in the area of the sternum, because the sternum actually, about 5 to 8% of us have a foramen. This is a congenital abnormality where the plates have not fused, and it's usually around the area of the fourth intercostal space. So I'm sure everybody's feeling along their sternum right now to see if they have a hole. It's really hard to palpate because you often have tendon or thin connective tissue over. But we want to be a little concerned if we are needling CV-REN17, CV17. If we're needling this acupuncture point, you want to always be needling in a transverse direction. That goes for all the points of that CV line as well. If you happen to be needling the rare sternalis muscle. It's not rare, it's just highly variable. Or pec major, again, you also want to be aware that you could have this hole in the sternum. Again, needling must be in an oblique, not a perpendicular direction. Okay, so nerve injuries, both the central or peripheral nervous system. Of course, whenever we're using a needle, I'm sure we're all aware that there are many reports of hypodermic needles causing tremendous neurological damage as a result of intramuscular needling. Our needles, of course, are a lot thinner gauge, but the signs and symptoms that you would see would be dependent on the type of injury. And these are things like neuropraxia, axontomesis, or neurotomesis. The most common that we see with dry needling or acupuncture is a neuropraxia. And the prognosis, again, would be variable depending on the amount of nerve damage. So when you're needling, if a person is starting to feel a burning or a shooting pain upon your needling activities, you may be hitting a nerve. So please be aware of that response from a patient. There was an Irish case study I'm going to share with you. This was a 27-year-old woman. She developed a neuropraxia of the radial nerve. They were needling around the area of the spiral groove for shoulder pain. And soon after, she developed a left muscle spasm, and that progressed to a wrist drop. What was really sad about this case is she had extensive hand therapy and splinting, but nerve conduction and EMG studies down months later still showed no signs of recovery. The one interesting thing about this case was the needle they used. When I was looking at it, they were using a 50 millimeter length needle, which is very long. You really always want to choose your needle size for the part that you're needling and the patient size that you're working on. So this was a very long needle for a very a small part of the body. So again, I think one thing you're seeing with this this report, the most important thing we have to understand is anatomy. And this slide shows some great reference articles. I highly recommend you can get them easily through PubMed. They come out of Germany. They look at all the different body parts and specifically related to anatomy for acupuncturists. But if you're someone who does dry needling, I think there would be something for you to find of interest. I highly recommend that you get these, because the knowledge of anatomy and the skill to apply it is arguably the most important facet of a safe and competent practice. Okay, we're almost done, and then we'll have time for some questions. Okay, pregnancy. Okay, we often know that low back pain and pelvic girdle pain is common during pregnancy, and both acupuncture and dry needling could be helpful in the symptomatic relief. Now, if you're an acupuncturist, you learn that certain acupuncture points are considered to be forbidden to needle. Some of them are because they are felt to stimulate uterine contraction, and as a result, they could cause a miscarriage or early labor to start. Others are forbidden because of the location, proximity to the uterus. Now, research into the veracity of these points is not proven because we avoid their use during clinical practice. So what does the evidence show? Well, first of all, there are a lot of inconsistencies on the exact points in this list. I've listed what most people feel are the points you should avoid during pregnancy. The ones on the left are the ones that seem to have a somatovisceral reflex that could cause uterine contraction. And the ones on the right are the ones in the front that could end up being a problem, especially with the growing fetus. What does the research show? I love this report by David John Carr in 2015. They looked at so many areas in the literature about how harmful it is to needle these points. They looked at animal studies where they had healthy pregnant rats and they did acupuncture to the forbidden points. They looked at studies where they actually had used spleen 6 and large intestine 4 in order to try and terminate a mid-trimester pregnancy. They actually tried to use this as a way to abort a fetus. And then they looked at acupuncture that had been used in observational studies or controlled trials sort of by accident. Sometimes people didn't know they were pregnant and they were needled with these points. The bottom line is there was a lack of evidence that any of these points could cause harm to the growing fetus. That does not mean, however, that they are safe, and they are very strongly want you to look at the article and make your own decision. So what do most of us do? McDowell out of New Zealand, they looked at acupuncturists and dry needling during practice and looked at what physios there did. I want to just bring up a couple of points. First of all, we know that miscarriages occur in about 10% of pregnancies. And of these, 80% are going to happen in the first trimester. Now, if somebody comes to see you, and especially in the first trimester, and you do acupuncture or you do dry trigger point, and later that day they have a miscarriage, they may blame that treatment. Whether or not it is anything you've done, they will blame you. So we have a lot of concerns, especially when treating pregnant women. You may want to avoid treating them with these needling modalities in the first trimester, because that's when most of the miscarriages can occur. You want to avoid using strong stimulation techniques and avoid those specific points, because ultimately you will be blamed if something happens. Okay, last, we're going to look at broken needles. Fortunately, this is a rare problem because we use single-use disposable needles. In the old days, when they would use needles that would constantly be sterilized, you would get some fatigue in the metal, and cracks or erosion could cause this. The most common area where a break could occur would be at the root of the needle, and that is where the shaft and the body meet. Anytime you're using a needle, you always must keep at least a quarter to a third of the shaft above the skin. So again, you want to use the correct needle length for the body part that you're needling, whether it's acupuncture or dry needling. Again, if you do break off a needle, it could be life-threatening. How hard is it to break a needle? Well, this article from Lowe actually looked at the mechanical compressive force needed to break a filiform acupuncture needle, and they tested many lengths and gauges. They used this thing called an Instatron universal testing system. They were unable to break any needle. They sometimes had a permanent bend occur because of a high load, but they basically concluded in this article that needle breakage is unlikely to occur with muscle spasm or sudden movement. What would you do if something happened? You had a bad needle and it broke off. You would stay calm and not have the person move. If you saw a part of the needle above the skin, you're gently going to remove it with forceps. If it's at the level of skin, you would gently press the tissue down until you grab that broken end. If it's under the skin, what you have to do is mark the place of needle entry and seek medical transport, because they're going to have to get that surgically removed. Again, I've never seen this with the needles we use. Please buy good needles. Okay, now we're almost done. We'll start with some Q&A. I just want to tell you about two quick stories. This study came out of 2010. This was a healthy 46-year-old woman. She presented to the ER with a complaint of a foreign body. She'd been eating some potato chips. I hope they were Old Dutch. And she felt one lodge in her throat. And an x-ray actually showed a needle foreign body, and she eventually had to get this removed. 6 months before, she'd had some acupuncture for a whiplash injury. She didn't remember if one of the needles broke, but she had continued pain, and she just blamed it on the motor vehicle accident. And last year, 2019, Snyder described a case of a 52-year-old man. He'd had acupuncture treatments for chronic neck pain in another country. During one of these sessions, the needle actually broke. The acupuncture couldn't remove it, sent him off to the hospital for x-ray, and the x-ray actually did show this needle fragment. They said he was good to go, fly back to the U.S. What happened during the flight, this needle, it was around C1, C2, it actually migrated 3 centimeters. Upon landing, he went to the hospital, and they had to surgically remove it. By that time, it was 2 millimeters from the vertebral artery. So again, this can be life-threatening. The reason this report was written up was, of course, he required extensive physical therapy to regain his neck movement. Okay, so we're coming to the end of the talk. How common are adverse events? Well, we really, really don't know. It's probably going to be trending upward as the increasing number of clinicians are using needling in practices. And how do we prevent them from occurring? Again, the most important things are a complete and thorough patient history. You want to have an informed consent, use appropriate infection prevention techniques, and good documentation, both of needling insertion or treatment response. And if the person does require medical care, again, documentation is important. The last thing on this slide shows a link to the APTA. They have a really good resource on the appropriate patient selection for dry needling, and I highly recommend you have a look at it. Also, in your own Physiotherapy Alberta College websites, there are some really good guidelines on how to develop a critical event management plan and an informed consent form for your patients. The safe practice of needling has to be an integral part of both our initial foundational training and our continued training in these treatments. And again, I hope that someday that we will have an increased ability to track how common these problems are. Anyways, okay, let's see if there's any questions out there.
Thanks so much, Vanessa. That was so interesting. We do have a few questions, and
okay.
One, Muthul is asking if we can, how we can diagnose, or can we diagnose sternal foramen with an X-ray?
Oh yes. Yeah, I'm sure. Yeah, that's how they look at it. You know, they can see that hole. I'm sure if there is a foramen, it will show up. There's also problems I've read about foramina in the infraspinous area and the supraspinous area. So if you're needling supraspinatus or infraspinatus, you have to be aware that there are these small holes, and theoretically a needle could penetrate through. So if you are doing dry needling of that rotator cuff area, and the needle, you're not hitting the bone when you think there should be a bone, please don't just let that needle keep going further and further into the thorax.
Perfect. In general, within what timeline should you see the needling effect or response having occurred in the context of pregnancy and DN?
That's, I mean, if you have used one of the forbidden points and create a increased rate of labor? Yeah. You know, that's a good question. I know that as an acupuncturist, we often try and bring on the labor and use these points if somebody is past their due date. Sometimes I've had people on the table and they started to feel a quickening. But the bottom line is, if you look at that article from Carr, if a person has a healthy pregnancy, it is almost impossible to create to bring on a labor, okay, especially in the first 2 trimesters. So when you're seeing someone at the end of their pregnancy, you might feel like if you are stimulating those forbidden points to try and bring on the labor, you would usually see that within about 48 hours. At least that's my clinical experience.
Thanks. Kate wonders what your informed consent spiel is for your patients. What do you say to them?
I probably pull it up. I basically want to know if people are pregnant or are thinking of becoming pregnant, because again, if you're seeing somebody over a year, you might not know that they are pregnant. I also want to know about medications and just the fact that they may have side effects. And I do include all of the ones that I've listed about, some of the things that can occur. We can have a pneumothorax. I don't want to scare the hell out of people. That's the thing, is like you want people to understand that these risks involved, but they are very rare. I really highly recommend that you look at the Alberta College of Physiotherapy website, because it's really good, their information on getting the informed consent. It's a little different up here in the U.S. because one of the rules that we have is people they don't have to have a physician refer them for acupuncture, but we have to say you should also see Western medical doctors. So the informed consent is going to depend on where you are in the world. Again, your provincial guidelines, I think, really are the ones that you should be following when you're developing that. So you want somebody not to be terrified that they're going to get a pneumothorax, but just to understand that these are risks involved. And again, looking at people's medications, making sure that there's not a reason that they should not be receiving this therapy is important. I hope that answers the question.
Yeah, thank you, and thanks for pointing our participants to the website. There has been a lot of work done on restricted activities and needling specifically, and there's some really good resources on the website for anyone. It's open to anyone.
Oh,
Sorry, go ahead.
I've used a lot of the website material when I was doing research for my papers. I think it's among the best. It's the best in the world, but I really think your provincial society organization has done a really good job at looking at the problems associated with dry needling and acupuncture, and whoever's written those should really get kudos.
Thank you. Thank you. I will pass that on. I think she's actually listening.
Okay.
Karen is asking if you can speak to strategies for preventing forgotten needles.
Oh, thank you. Thank you for asking this question. For about 20 years, I worked in a college and I worked in the student clinic, and this was one of my pet peeves. I said to people, you put it in, you take it out. So if you're doing acupuncture where the needles are, of course, kept in the body, most important thing is after you have completed your needling, you're going to take, you're going to write down exactly what the points that you put in. Right large intestine 4, bilateral bladder 23, what have you. And then the number of needles that you have put in. You're also going to, I always keep my empty needle packages off to the side. So let's say I put 23 needles in. I put my needle packages off to the side. When I go to remove the needles, I don't let people talk to me. I don't talk to them. If people ask me a question, I go, shh, and I feel very rude, but I'll say, I'm sorry, I can't talk and take these needles out and count. You never want to go, was that 14 or was that 13? And have the person say, you know what, I found a needle in the back of my neck when I came home, took my scarf off. Okay, so you always want to take all the needles out, you look at your chart, you go, oh, that was 22 needles. And then you start going through every needle that you put in and find out which one is hiding. So again, triple check. Nobody is going to be upset with you if you say shh when you're taking the needles out. Everybody understands how important it is to remove the needle. So that's what I would do. Now, when you're doing dry needling, of course, often we don't retain the needle in the body. It should be coming out with you. Okay. Also be aware that sometimes, especially if you're using points in the ears, for example, sometimes the needle will fall out. So you know, if you can't find it in the body, look around the table, look on the paper, and you'll find it. But don't let the people get up without making sure that you have checked for every single needle.
Thanks, Vanessa. Kate would like to know if you include talking about hematomas. I'm assuming she is talking about during the consent process.
Yes, I do. I do tell people, you know, we're using needles. They're very, very small. I usually say they're about as wide as your hair. And I said, anytime we pierce in the skin, we may get a bruise or some bleeding, but it should be pretty minimal. And I tell people, you know, especially because normally if you've had acupuncture or you do acupuncture, you know that when you remove most needles, you don't get any blood at all. The one thing that I do tell people is sometimes if you've been taking a lot of Advil or other medication of that type, you may end up having a little bit more bruising or bleeding. The one place that you have to be really careful with is if you are doing a lot of facial points. So if you're working a lot on TMJ or if you're doing facial acupuncture, again, you may, you know, a body bruise, most people will go, you know, no biggie. But if you get a big bruise on the masseter area, that might be a different case. Whenever I'm using and needling the face, I always apply some digital pressure when I take the needle out, even if there's no blood, just to actually compress the tissue and avoid that from happening.
I'm sorry, Kate clarified she means serious hematomas. So
okay.
I'm not sure if you've answered that.
Oh, well, actually, I did have one serious hematoma in my professional life. Early on in my acupuncture career, I was seeing an elderly man in his house. And what happened was after I left, and again, the treatment went fine. After I left, I did get a call from his wife that, like, over the next couple of hours, he developed quite a large hematoma it was on his thorax. And what had happened, the reason this had happened was this gentleman was on anticoagulant medications, but had gone into the hospital. They were changing out his pacemaker battery, and they had been mucking around with his doses, the level of anticoagulant, and he created this hematoma. It was completely, it just looked bad, but he had no pain at all, and it did go away. But so again, this was not evident when I was actually at his house. It sort of developed later that day. Certainly, that case of that woman who developed the complex epidural hematoma, I mean, that certainly somebody that's complaining of this warm sensation all over their body, that would be something I would be really concerned about. I certainly would have called her back the next day to see how she was faring.
Perfect. So thank you very much, Vanessa.